The focus has shifted to rehab in a big way now. Previously, if you see in the daily life, if somebody has got a stroke, he's got a stroke for life. Now everybody is very conscious and aware about their quality of life. They don't accept mobility. They want to be back to the functional life, professional life, social life. And that's the need for rehab, strong rehab and advanced rehab, not conventional method where you just keep massaging the arm and the leg and hoping for it to recover. So that's why neuromodulation based rehab therapies have a big role to play now. These are not gimmicks. These are FDA approved and internationally approved technologies.